Let's read her epilogue, shall we? Hey, y'all, we 3 for 3 so far. Before reading epilogue, see FTG in result codes booklet. Okay. FTG. That's kind of scary. That's not ominous, actually. Yeah, not ominous at all. If you did not administer or prescribe Levectra something, I did not. Take story card 41. Uh-oh. What a night. It's challenging being a doctor. So many details to track. Miss one and it can be disaster. You've just taken a shower when the hospital calls. Gabriella is back in the ER. After she got home, she went into status epilepticus. Her seizure lasted 17 minutes before the ambulance EMTs arrived and gave her anticonvulsant. She's still unconscious. It's unclear whether she has sustained any permanent brain damage. As you hang up, you realize your mistake. With her condition, she could have had additional seizures. If only you had given her that when you had the chance. No way. No. I gave her the what? No. I thought that the Prozaxanol was for the... No. Fuck. Gabriella seems... I'm really hurt. Gabriella seems pretty set on having you take care of her face blotches first. She's also uncomfortable about having her mother present. If you ask about her YouTube channel, she opens up and confides in you that she smokes pot but didn't have sex during her stay in Brazil. While helpful, it's still unclear whether she's being entirely truthful with you. However, when Gabriella experiences a seizure at 2 a.m., her condition becomes much more serious. With Nurse Judy's timer ticking down the seconds, your best course of action is to wait and see if Gabriella's seizure will quickly resolve on its own. Lorazepam will stop a seizure, but if you administer it within the first 5 minutes of the seizure, it may oversedate Gabriella and cause her to stop breathing, which it did. If she does, you need to intubate her, put a tube down her throat, to make sure she keeps breathing. When Gabriella's seizure resolves within 3 minutes, there is no longer a reason to give her lorazepam. However, to prevent Gabriella from having another seizure until you find the cause, you should give her levexatrexam, which I did not. Once the seizure is over, you consider possible causes. A drug test rules out drugs. While blood tests come back normal, an abnormal EEG suggests you can run more comprehensive tests. A brain CT scan shows Gabriella's brain is normal, but CT scans are not as effective as an MRI in revealing soft tissue conditions. If you run an MRI, you discover that Gabriella has nodules in her temporal lobe, which would point to any number of serious conditions. A lumbar puncture eliminates the possibility of meningitis and leukemia. To learn more, you'll have to perform a craniotomy and get a tissue sample of Gabriella's brain.